About 3.4 million HIV-positive South Africans take these life-saving drugs every day. Antiretrovirals suppress the AIDS virus and help the body maintain a healthy level of white blood cells. Previously, the health department only offered ARVs to patients whose immune systems had weakened to a certain level defined by a CD4 count. But from the beginning of September, all HIV/AIDS patients will be eligible to receive the drugs.
It's one of the many milestones that our country has ever had. South Africa is one of the first few countries in the continent that adopted test and treat. And this goes a long way with the United Nations Fast Track 90-90-90 program, because that will help us meet the targets of ensuring that people get treatment early.
South Africa has the biggest HIV/AIDS treatment program in the world. More than 3.4 million people receive ARVs for free. The new policy means that many more patients will be approaching the healthcare system.
It's going to be a challenge, but a challenge that I think the South African government has factored when adopting this test and treat option. In May this year, the Minister of Health was given an extra R1 billion to include into this. So there is a lot of mechanism put in place to ensure that the system doesn't collapse.
Although some rights groups and charities are concerned that the government has the capacity to handle the increase in people requiring HIV treatment, ordinary South Africans have welcomed the decision.
Very important to encourage them how to prolong their life, and it's very good to start the ARVs before you get sick.
Also gives an awareness to other African countries with regard to how they can actually improve their medical conditions to individuals around the country or continent as Africa. Yes, so I believe that it is actually a good thing to do.
The government has officially adopted the World Health Organization's test and treat guidelines. It's going to weigh heavily on South Africa's healthcare budget, costing around $66 million this year alone. But the government is convinced it will improve the quality of life for people living with HIV/AIDS and reduce the level of new infections. Scheier, CCTV, Johannesburg, South Africa.